Welcome to CNTV. I'm Brad Clonch along with Quin Tran. We're following the number of COVID-19 cases. In July, the number is up in several areas of the country.
And that includes Oklahoma. Chickasaw health officials stress the importance of wearing face coverings and responsible distancing. Dr. Krueger, we're seeing an uptick this month in the cases, in coronavirus cases. Should we be concerned?
Yeah, that's correct. So, the United States added almost, we think right around 60,000 people in one day of infected. And we're seeing largely the same thing here in Oklahoma. We think the percent positive in Oklahoma has gone from roughly about 2% or less on the positivity rate up to as high as 9%. In certain counties. Within our Chickasaw Nation testing, we're seeing similar numbers, although what we have seen within our employee population is not numbers that high. And I think that's really because we've adhered to a lot of the risk mitigation strategies. But, we are concerned about these numbers because at some point in time, we all live in these communities where we're seeing these numbers go up. We're also seeing our hospitalizations increase across the state. We're seeing our ICU utilizations increase. And we know that even though the death rate is lower, the number of people being infected is much higher than it's previously been in this area of the country.
On July 7th, the state reported the largest one-day increase. We're talking about 858 new COVID-19 cases. What are the factors to this? Is it because of the recent holiday weekend, more testing, more people out and about in the summer, a combination of all of this? What would you say is the rise for this?
Yeah, I think to put this in perspective, we saw a 27% increase in positives. So in other words, 27% of all of our positives since, we've been testing for almost 4.5, 5 months, 27% of all of our positives occurred in the last 5 or 6 days. So that's a pretty big number, to have more than a quarter of your positives show up in that short period of time. It's not something you can see. It's something that's microscopic, so it almost is, seems like an existential threat when it's not affecting you. And once it affects people, a lot of times their story changes because, if you have a bad reaction to COVID, it can be pretty traumatic to someone. So I think, folks are just basically exhausted. You hear it all the time. We have COVID fatigue. That's very normal. And typically what happens is people will start to let down their guard and think, well, I can hang out with my friends. I know my friends, I think they're okay. Bad news about COVID is you look fine many times, and you may have, most people will be asymptomatic, but are actually actively spreading the virus without having any symptoms. So just talking to someone within close proximity, or meeting around a dinner table where you're sitting close to one another, or having a backyard barbecue, or riding in a car with another group of friends, going to a ball game and sitting in the bleachers, with everyone. All those things are things that we would normally do during the summertime. There's nothing wrong with those in normal times. But during COVID, that's exactly what the virus takes advantage of. Basically, what we're seeing, the most cases we're seeing with spread have happened when people have gotten together for family gatherings. Church gatherings appear to be pretty problematic at times, especially if there's been a lot of singing or those sort of things going on. I think some of our churches are figuring out how to social distance or really encourage mask wearing. But all it takes is a few people that are infected in a room, and then those indoor spaces seem to be significantly worse in terms of being being areas where we see a lot of viral spread. Now, like I said, most people get sick, they get over the virus after a period of time, but that time period when you don't really know you're sick, or you might have never developed symptoms, you can inadvertently spread that to a lot of different people, some of whom will get very sick. And that's what we see in the health system then. You'll never know that you might have spread it to those people either, necessarily.
And that is why mitigation efforts are important. The hand washing often, wearing face coverings, and the responsible distancing. That remains very critical right now. Face coverings can prevent transmission by 80 to 90%. That's an incredible percentage when we talk about prevention.
We have biologic plausibility now through some of the studies that have gone on showing that, when you wear a mask, it stops the respiratory particles from spreading very far. It really helps the other person more than it helps you. But if two people do it, we're helping everyone else out with that. When you're out in public, when you're at a ball game, when you're in church, when you're having a family gathering, and that's why eating around other family members that might particularly be, or friends that might particularly be affected and not know it. We think that's where a lot of this goes on is how people are coming in contact with the virus.
So with that in mind, would you caution people to go to their checkups, therapy, physical therapy, medical visits like that during this uptick in cases?
Yeah, I think that has to go on. Obviously, we've modified a lot of our operations. There's certain things that we cannot do because aerosol generating procedures we have to be really cautious with because getting your germs up in the air, not only can that infect a lot of our medical staff if that were to happen, but it can affect other patients as well. So, we have to think about you, and we want to make sure that we are protecting the most vulnerable people that would be in the room. And that's the level of safety that we apply to everything. I think that's one of the reasons we've seen such low rates of infection within our health system, is that our medical staff really do adhere to the rules. The point with health is that what we're starting to see now is we need to treat some of these chronic conditions that are going on. We need to have these kids immunized, or we're going to have another problem if we don't do that. So we're trying to make safe decisions. There's certain surgeries and procedures we have to get completed. If we don't, we're going to have harm done to patients because we're waiting too long on that. So we're trying to get those sort of services going again. But the higher the spread of the virus in the community, the more that slows down those efforts. So we really do need the public's help in trying to do their part, help us keep those vulnerable citizens safe. And I think if we can do that as a society and as a group, we can emerge from this thing in relatively good shape. If we don't, I'm starting to get worried. The hospitalization rates, yes, we are seeing our rates of hospitalization for COVID-19 increase at Chickasaw Nation. I've also spoken to my colleagues in larger cities, Tulsa and Oklahoma City, who work there, and they are in particular having a very difficult time trying to treat people. So what I worry about the most, or one of the things I worry about the most, is once we, in rural America, once we lose the ability to ship to those tertiary centers, we have to take care of you the best that we can out here. So we have a great ICU, but only have 6 beds. I have a limited number of hospitalists, so I have to keep them from getting, I have a limited number of ED physicians. I have to keep them from getting sick, or they can't take care of everyone else.
At this stage in the pandemic, what would you want Chickasaw citizens and Oklahomans to know about COVID-19 at this stage that we're in?
I'd really request the public's help and assistance. We do need them to take this seriously. It's small things, but a mask, number one, mask. Number two, if you're out in public or having family gatherings, maybe don't have the family gathering, or if you do, like gather where you're all at a distance and eat in separate areas when you don't have your mask on, and wear your mask around folks. Be careful about indoor events. Absolutely. Be careful about enclosed spaces and indoor events. You just cannot tell who has the virus and who doesn't. We think if you follow the mitigation strategies that we put in place, our screenings at the front door, we ask you to wear a mask when you're in our facilities. Our goal is not to try to make it so restrictive so that people feel like it's oppressive. It's actually a safety. It's the same way we would ask people to wash their hands or do those sort of things. That's another thing, washing your hands. That can help because we all rub our faces and our nose and other things like that. So that can help to some degree, but we think most of the spread with COVID is occurring through the air. It's occurring through just normal speech and communication. And it's occurring, occasionally we cough or we sneeze, and that really blasts it into the atmosphere. And if you don't have great air handling and disinfection practices, that allows a lot of people to be infected. For every person that has coronavirus, they're infecting at least 1.13 or 1.2 more people. So we want to get that rate down below 1. Once we get it below 1, you're not able to pass it on as effectively. But over 1, not great. And so we kind of went the wrong direction, over the last couple weeks, and now we're seeing large spikes. What caused that? I'm not entirely sure, but it probably was a mix of, folks kind of coming out of the reopening phase and wanting to be together again. That's very normal. But like I said, most of the spread and transmission we've seen has occurred with families, with friends, with groups gathering. They're not even large groups. Large groups are problematic because one person can spread it to many, many more people. Mathematically, it just increased the rate. But I think most of the spread is actually occurring between relatively small groups. I think if people stop and think for a minute about, hey, I'm going to wear a mask because it's just a form of respect. We're taught to be respectful as as professionals, to say yes sir and no sir, and yes ma'am and no ma'am, and to have great manners and all these other sorts of things that we learn. But a mask is kind of the 2020 version of having good manners, I would say. A way that you can show respect for other people that may be, even if it's only psychologically, scared of their risk. And I think it will allow more people to participate in society and be part of reopening. And it will also be a great way that we can do something together.
Because of the pandemic, the Chickasaw Nation has postponed several tribal events, including the Chickasaw Hall of Fame induction ceremony.
A virtual announcement about the ceremony was released this month. Take a look.
Has the ball. He shoots. It's good. USA wins. USA wins the goal.
On this day, we hereby dedicate the mural Flight of Spirit by Chickasaw artist Mike Larson.
Accomplishments we have made and the greatness we have yet to achieve are connected by the strength of our people. We never give up. We look ahead. We progress. We conquer our fears and make the most of our talents and abilities. we will continue this greatness through the legacy of the persevering Chickasaw spirit for generations to come.
Chick Ma, induction into the Hall of Fame is a great honor. Due to recent events, we were not able to come together for our planned ceremony. However, we want to take the time to honor these remarkable individuals. We look forward to celebrating their achievements in person when it is the right time to do so.
Governor Bill Anatubby says 5 Chickasaws will be inducted into the tribe's Hall of Fame. They include Chickasaw legislator Tim Colbert, retired Rear Admiral Kevin Meeks, and former tribal judge and legislator Ron Parker. Lillian Blackwood Fowler and John L. Hilton will be inducted posthumously. In upcoming episodes of CNTV, we'll share more about the special inductees and their talents and contributions.
Another Chickasaw citizen, Caleb McCaleb, was recently inducted into the Edmond Public Schools Foundation Hall of Fame. He spoke to us about the honor, his mentor, and message to young people.
How meaningful is this induction for you?
It was very meaningful for me. You know, the thing about Edmond schools is it's my first passion, you know, and that being raised from kindergarten all the way to the high school really made an impression on me. So I was very proud to be honored by Edmond Public Schools.
Do you have a favorite memory of school or a favorite teacher?
So this is interesting. When I was in second grade, I had a teacher at Russell Doherty Elementary School named Babe Hamilton. And every morning she would line us up and she would point to our shoulder blades and say, "You little angel, you can feel your wings are starting to stick out." And we all believed that we had wings that were coming because she made us her little angels. And she would literally go around and hug every child in the classroom every morning. And I was like, and that started my love of school.
As a business owner, you started a successful home building business more than 30 years ago. Give us some insight on the ups and downs of those years, and really we can gain some of that insight, especially in these unusual times.
You have to be flexible during tough times and good times. And so that's really what I've learned. I've also learned we have to adapt about what we build and what we how we do things, feedback on what the market's doing, and what should we change and what should we do, and I think listing has really helped us a lot.
Many of us have left Oklahoma and then find our way back. What is it about Oklahoma that brings you back?
I think it's the people. I've been to a lot of places, and I think most importantly, it's the people of Oklahoma, the love that they have for each other, the commitment they have for each other that brought me back to Oklahoma. And, we have so much family in this area. Right now during this pandemic, we're not able to get together like we usually have, but it's just having your family here around you too.
Caleb, who has been most inspirational to you in your life and your success?
Actually, this is interesting, but my dad, Neil McCaleb, who's one of the ambassadors for the Chickasaw Nation, has been my biggest influencer in my life. I love my dad, and he's not only an influencer, but he's one of my best friends. A lot of times in our lives, we have people that come into our lives that we have felt like they've maybe mistreated us or haven't treated us fairly. And what he's always told me is just forgive and move on. And that's been a real blessing to me in my life.
I've enjoyed learning about your philanthropic work. You see it as a mission to give back to others.
We've built a lot of charity homes where the charity will get all the money from the house. We've done Street of Dreams, those kind of things to raise large sums for we've done with Make-A-Wish Foundation. We've done Children's Hospital Foundation down at OU in Oklahoma City several times. And it just makes a joy, especially when you go into facilities and you see what the difference that money can make. And you say, well, does several $100,000 make a difference? when you have these charity events absolutely makes a difference. And so it's back to, we need to put our kids first, and almost everything that we do is child-based. My wife and my kids and my extended family have all joined in. It's so fun to watch, like, for example, when we do a dream home tour, Street of Dreams, seeing my kids out there, working side by side with the other volunteers and with the kids that are coming from the Children's Hospital to be part of it, and for Make-A-Wish kids to be part of it. It really opens your eyes to how important that is. We've actually, with Henderson Hills Baptist Church, we've taken quite a few teams. We've built churches, 12 or so in Nicaragua. We've built them in Mexico, Brazil, Wales, Brussels, and Belgium. So it's really been one of my joys in life to be able to go into community, and we work side by side with the locals to. It's not only their church; it becomes a community area for that group. I was actually in Honduras on March 13th when all this taken place, and where I was, they didn't have any infections yet, so they shut down all airports, all boats, everything was shut down. So we were there for several weeks, and so it was interesting when being in Honduras from March 13th to the end of the month, listening to what was going on in the United States without, it was basically, you understood how fast this thing spread across the world.
So you've gotten to see, on an international point of view, how this pandemic occurred so quickly.
Yeah, it was interesting. So they basically flew to get us something called ghost planes, and what a ghost plane is they don't want people coming in, so they would fly these empty jets down. United flew these empty jets down to pick us up. And when we came to U.S. Customs in Houston, there was no one in Customs. I'm sure you've seen Customs when it's jam-packed. There was no one there. It was kind of a wake-up call, like, oh, wow. Because until then, I think the middle of March, when this really started rolling, I think a lot of us didn't think it was going to be that serious.
What are your words of wisdom for the next generation?
How do I make a difference, right? And I think that is through, whether it be your work or you volunteer in the outside, go help, go be involved, make your voice heard through your actions, not just, over the internet. Go do something.
Caleb McCaleb is a 1980 graduate of Edmond Schools. You heard him talk about his father, his mentor, Mr. Neil McCaleb. He's an admired Chickasaw who is also a Hall of Famer.
The Chickasaw Elder is an inductee in both the Chickasaw Hall of Fame and the Oklahoma Hall of Fame. Before we leave you, we want to remind you about the Artesian online art market. The Chickasaw Nation is hosting this website, artesianartsfestival.com. View and purchase items created by talented Chickasaw and Southeastern artists. You have until July 31st to visit artesianartsfestival.com. We've enjoyed sharing with you this episode of CNTV.
We'll see you back here soon.